World War II was a time of unprecedented conflict, not only on the battlefields, but also behind closed doors in secret laboratories. Amid the chaos and destruction, the Nazi regime carried out some of the most horrifying experiments in human history. These experiments were not just cruel, they were a deliberate attempt to manipulate, harm, and dehumanize thousands of innocent people under the guise of science. The ideology that drove these experiments was rooted in the concept of racial superiority. The Nazis believed in creating a master race and saw certain groups, primarily Jews, Romani people, disabled individuals, and prisoners of war, as subhuman. This dehumanization allowed them to justify horrific medical procedures that would be unimaginable in any other context. What followed was a systematic campaign of scientific brutality, conducted in concentration camps and secret facilities across Nazi-occupied Europe. The scale of these experiments was staggering. Thousands of prisoners, often without any understanding of what was happening to them, were subjected to procedures that ranged from the physically excruciating to the psychologically devastating. Some were infected with deadly diseases, exposed to extreme temperatures, or deliberately mutilated in the name of research. Others were used in experiments that attempted to manipulate human biology, test chemical weapons, or explore the limits of endurance and survival. Among the most infamous figures in this dark history was Dr. Joseph Mengele, known as the Angel of Death at Auschwitz. Mengele became a symbol of the cruelty inflicted on prisoners, particularly children. His experiments included the study of twins, genetic anomalies, and the effects of various medical procedures without anesthesia. The sheer inhumanity of his actions and those of other Nazi doctors shocked the world when the full extent of their work was revealed after the war. But why did these experiments occur? In part, it was the perverse combination of ideology and scientific curiosity. Nazi doctors believed they were advancing medical knowledge, often ignoring basic ethical principles. In their minds, the suffering of prisoners was justified by the potential benefits to the German state and the so-called advancement of science. Yet, in reality, these experiments provided little genuine scientific insight and caused immeasurable human suffering. In this video, we will explore the chilling details of these inhumane laboratories. We will examine the types of experiments conducted, the methods used, the people behind them, and the horrifying consequences. This is not merely a story of medical history, it is a story of moral failure, of human cruelty, and of the importance of remembering the past to ensure that such atrocities never happen again. As we journey through this dark chapter, it is important to approach these events with sensitivity and respect for the victims. The stories you will hear are difficult, sometimes unbearable, but they are a crucial part of understanding the depths of human cruelty and the strength of those who survived. By shedding light on these crimes, we honor the memories of the victims and learn essential lessons about ethics, morality, and the responsibility of science. This introduction sets the stage for a deeper exploration into the Nazi human experiments. From early experiments in racial hygiene to the extreme medical tortures carried out in Auschwitz and other camps, we will uncover the systematic cruelty inflicted on countless individuals. Prepare to witness one of the darkest periods in scientific and human history, a period that reminds us why vigilance, empathy, and ethical responsibility are vital in every aspect of human endeavor. Before the full-scale horrors of Auschwitz and other infamous concentration camps, the Nazi regime had already begun experimenting on humans in smaller, controlled settings. These early experiments laid the groundwork for the later, more extensive atrocities. From the early 1930s, Nazi doctors and scientists conducted experiments that were often framed as scientific research, but in reality, they were deeply rooted in ideology, prejudice, and a blatant disregard for human life. One of the primary focuses during this period was the so-called racial hygiene programs. The Nazis believed that the purity of the Aryan race had to be preserved at all costs. This ideology drove policies targeting those they deemed undesirable, including Jews, Romani people, the mentally disabled, and other minority groups. Early experiments included sterilization programs, which sought to prevent certain groups from reproducing. Individuals were subjected to forced sterilizations, sometimes using crude surgical procedures without proper anesthesia or consent. Hospitals and clinics became centers of coercion rather than care, as physicians acted as agents of the state rather than healers. Another horrifying aspect of early Nazi experimentation was infectious disease research. Prisoners and marginalized groups were deliberately infected with diseases such as tuberculosis, typhoid, and gonorrhea. Scientists studied the progression of these illnesses, often withholding treatment to observe their full effects. In many cases, victims died as a direct result of these studies. The medical rationale was often thin, but the experiments were justified through ideology. The lives of those deemed inferior were considered expendable in the pursuit of scientific knowledge. In addition to sterilization and disease testing, early experiments also targeted mental health. Individuals with mental illnesses were frequently subjected to electroshock therapy, forced medication, or experimental surgeries designed to alter behavior. Some experiments aimed to test the limits of pain tolerance or to induce psychological trauma in order to better understand the human mind. Children were not spared. Young prisoners were often the subjects of cruel tests designed to study growth, development, or hereditary traits. These experiments were often justified under the guise of eugenics, a pseudoscience that claimed to improve the human race through selective breeding and the elimination of so-called defective genes. Prisoners in these early experiments were subjected to brutal conditions that mirrored the larger camps that would later become notorious. They were often kept in overcrowded and unsanitary facilities, malnourished and deprived of basic human dignity. Many were coerced into participation under threat of punishment or death. Others were misled with false promises of medical treatment or release. Regardless of the method, the result was the same: intense suffering, permanent injury, and death for countless victims. Doctors and researchers behind these early experiments were often highly educated and well-respected within the Nazi system. They exploited the combination of state support, ideological alignment, and scientific curiosity to justify their actions. Some claimed they were contributing to the advancement of medicine or preparing for wartime necessities. However, the methods were inhumane, the consent was non-existent, and the underlying motivation was almost always rooted in ideology rather than genuine scientific inquiry. One notable example of early experimentation was conducted in mental hospitals and euthanasia centers, which later fed into the infamous T4 program. The T4 program aimed to systematically kill disabled individuals who were considered life unworthy of life. While these early programs were not the large-scale extermination efforts seen later, they represented a chilling normalization of cruelty. Doctors became accustomed to experimenting on vulnerable populations, paving the way for more extreme measures once the war escalated. Another aspect of early Nazi experiments was the attempt to understand hereditary traits and racial characteristics. Scientists collected blood samples, measured skulls, and documented physical and behavioral traits, often in a pseudoscientific attempt to link biology with moral or intellectual capacity. These studies were part of the broader eugenics agenda, providing what the Nazis saw as evidence for their policies of segregation, sterilization, and eventual extermination. While framed as research, these studies were deeply dehumanizing, reducing individuals to data points in a racist ideology. Despite the veneer of scientific legitimacy, the victims themselves were always human beings with families, lives, and identities. The early experiments served as a grim introduction to what would become systematic atrocities during the war. They revealed not only the cruelty of the Nazi me. As the Nazi regime expanded its control across Europe, the scale and brutality of human experimentation intensified. The concentration camps, Auschwitz, Dachau and Ravensbrück, became the epicenters of inhumane medical research, where prisoners were subjected to tortures disguised as scientific studies. These experiments were no longer isolated. They were systematic, coordinated, and often lethal. Doctors, protected by the state and driven by ideology, crossed every ethical boundary in the name of research. One of the most infamous figures in this chapter of history is Dr. Joseph Mengele, known as the Angel of Death, at Auschwitz. Mengele became synonymous with cruelty, particularly for his obsession with twins and children. He conducted experiments that sought to understand genetics, heredity, and physical anomalies, but at an unimaginable human cost. Twins were subjected to repeated procedures, injections with chemicals or disease pathogens, unnecessary surgeries, and intentional starvation or dehydration. Mengele observed how their bodies reacted to these interventions, often documenting the suffering meticulously for his records. Many twins died as a direct result of his experiments, while those who survived were often left with permanent physical or psychological damage. But Mengele was not alone. Across the camps, Nazi doctors conducted a wide range of medical tortures designed to test human endurance and physical limits. One set of experiments focused on the effects of extreme cold. Prisoners were forced into ice-cold water or exposed to freezing outdoor temperatures, sometimes for hours at a time. Researchers were interested in how long a human could survive hypothermia, what physiological changes occurred, and how to best revive a person from severe cold. These experiments were excruciating and often fatal. Survivors described the intense pain, numbness, and mental torment experienced during these tests. High-altitude experiments were another form of torture, conducted primarily at Dachau. Prisoners were placed in low-pressure chambers that simulated high-altitude conditions, sometimes equivalent to those experienced by pilots in combat. Scientists aimed to study the effects of oxygen deprivation on the human body, hoping to gain knowledge useful for the German Air Force. However, the subjects were often left to suffocate, collapse, or experience severe organ damage, all while researchers observed. Death and permanent injury were common outcomes, with no concern for consent or suffering. In addition to environmental experiments, chemical and pharmaceutical testing became widespread. Mustard gas, for example, was tested on prisoners to study its effects on skin, eyes, and lungs. Other chemical agents were administered to evaluate pain, blistering, and respiratory damage. Victims were often burned, blinded, or rendered permanently disabled. Pharmaceutical companies sometimes collaborated, providing experimental drugs or chemicals, highlighting a chilling intersection of profit, science, and human exploitation. Infectious disease testing also continued and intensified. Prisoners were deliberately infected with malaria, typhus, tuberculosis, and other deadly pathogens. Doctors withheld treatment in order to observe the progression of illness, documenting symptoms as the body deteriorated. Some prisoners were subjected to surgical interventions to examine the effects of disease on internal organs, often without anesthesia. Many perished as a result, their suffering considered necessary for the advancement of medical knowledge, or at least for the pretense of it. Surgical experiments were another hallmark of the camps. Doctors performed amputations, organ removals, and other invasive procedures without proper anesthesia. Sometimes these surgeries were designed to test the limits of human endurance or to find ways to save soldiers wounded in battle. Yet these experiments were conducted with total disregard for the lives or well-being of the prisoners, who were treated as expendable test subjects rather than human beings. Children were particularly targeted in these experiments. Mengele's twin studies often involved infants and young children who endured repeated injections, surgeries, and exposure to harmful chemicals. Other doctors experimented on children to understand congenital diseases, growth patterns, and the limits of human resilience. The vulnerability of these victims made the cruelty all the more appalling, and the psychological scars left on survivors were lifelong. Beyond the horrors of individual medical tortures, the Nazi regime also sought to use human experimentation to advance military science. Concentration camp prisoners were forced into experiments that tested the effects of chemical weapons, infectious diseases, and other technologies designed for warfare. These experiments were driven not by genuine scientific curiosity, but by the pursuit of military advantage and the belief that certain humans were expendable in the process. One of the most notorious areas of experimentation involved chemical warfare. Mustard gas, phosgene, and other toxic agents were tested extensively on prisoners, particularly at Dachau and Natzweiler Struthof. Victims were exposed to these substances to study their effects on the skin, lungs, and eyes. Some were forced to inhale toxic fumes, while others had chemicals applied directly to open wounds to observe blistering and tissue damage. Researchers meticulously documented symptoms such as skin erosion, blister formation, and lung inflammation. Prisoners endured unbearable pain, with many suffering permanent disfigurement or death. Scientists justified these tortures as necessary for preparing German soldiers to survive chemical attacks, ignoring the fact that their methods were indisputably lethal and immoral. Bacteria and viral diseases were another primary focus. Prisoners were deliberately infected with malaria, typhus, tuberculosis, and other pathogens. Malaria experiments conducted at Dachau involved repeated injections of infected blood or deliberate exposure to mosquito bites. The victims were observed for the progression of fever, organ damage, and mortality, often while being denied medical treatment. Typhus experiments forced prisoners into deliberately unhygienic conditions to study the disease's transmission, followed by testing vaccines or treatments under unsafe conditions. Many subjects suffered prolonged agony, and countless deaths resulted, all recorded coldly in laboratory notebooks. Tuberculosis research involved similar cruelty. Infected prisoners were sometimes subjected to surgical removal of diseased tissue without anesthesia or kept in poorly ventilated and overcrowded rooms to exacerbate symptoms. The goal was to simulate the natural course of infection and study potential therapies, yet the human suffering far outweighed any potential knowledge gained. Victims often endured months of illness, malnutrition, and isolation, leaving them permanently weakened if they survived at all. In addition to chemical and disease experimentation, other forms of weapon-related studies were carried out. Prisoners were subjected to controlled explosions, gunshot wounds, and surgical trauma to mimic battlefield injuries. Doctors observed how the human body reacted to these injuries, tested surgical interventions, and attempted to determine which treatments could save soldiers' lives. These procedures were conducted without anesthesia, and subjects were left to endure excruciating pain. Amputations were sometimes performed to study infection patterns, while internal organs were deliberately damaged to understand trauma outcomes. Prisoners often died from infection, shock, or neglect after the procedures, emphasizing the complete disregard for human life. Some experiments targeted the limits of human endurance. Prisoners were deprived of food and water, forced to perform exhausting physical labor, or exposed to extreme temperatures while ill or weakened. Researchers aimed to simulate the conditions soldiers might face in combat, studying starvation, fatigue, and exposure. Individuals were pushed to the brink of collapse, sometimes for days, and many did not survive. Survivors recalled the intense physical suffering, the mental anguish, and the constant fear of death, highlighting the inhumanity of these studies. Chemical and biological experiments were frequently conducted in collaboration with German pharmaceutical companies, creating a chilling link between business and human exploitation. Corporations provided experimental compounds, logistical support, and even medical personnel, all while gaining data from ethically unconscionable experiments. This intersection of profit, ideology, and pseudoscience meant that human suffering was not only tolerated, but actively encouraged. The human toll of these experiments was staggering. Exposure to chemicals often left prisoners permanently blinded, with severe respiratory issues, scarring, or chronic pain. Infectious disease trials caused organ failure, chronic illness, and high mortality rates. Surgical and trauma experiments left countless individuals disfigured, disabled, or psychologically scarred for life. Children and the elderly were not spared. Their vulnerability made the cruelty even more appalling. Survivors spoke of lifelong nightmares, physical impairment, and the haunting memory of friends and family who perished in these experiments. Despite the overwhelming evidence of suffering, Nazi researchers attempted to present their work as legitimate science. Detailed records, photographs, and data were meticulously kept to justify experiments as contributions to medical knowledge or military preparedness. Yet much of the research was methodologically flawed, scientifically unsound, or entirely redundant. The only consistent outcome was the suffering and death of human subjects, underscoring the moral bankruptcy of the regime's scientific endeavors. In some cases, these experiments had lasting implications on military medicine. While the ethical cost was immeasurable, post-war investigations revealed some information about disease transmission, chemical injuries, and trauma survival that tragically came at the cost of thousands of innocent lives. The methods, however, were never ethically replicable, and modern science condemns any replication of these studies. The legacy of these weapon and disease experiments was also legal and ethical. The Nuremberg trials, held after the war, documented these crimes in detail, leading to the creation of the Nuremberg Code. This set of ethical guidelines emphasized voluntary consent, the necessity of minimizing harm, and the accountability of researchers, directly responding to the atrocities committed in Nazi laboratories. The world learned that scientific pursuit without moral boundaries can become a tool of oppression and cruelty. In conclusion, the weapon and disease testing conducted by the Nazis represents one of the darkest intersections of science and war. Prisoners were subjected to chemical, biological, and trauma experiments that were brutal, often fatal, and entirely non-consensual. These studies were driven by military objectives and ideological justification, with complete disregard for human suffering. The horror of these experiments reminds us of the essential role of ethics in scientific and medical research and serves as a stark warning against repeating history's gravest mistakes. By remembering the victims and exposing these atrocities, we honor their suffering and ensure that the lessons of this dark chapter endure. While the physical tortures and disease experiments conducted by the Nazis are widely documented, the psychological and behavioral experiments carried out in concentration camps reveal another disturbing layer of human cruelty. Nazi doctors, psychologists, and researchers sought not only to study the body, but also to manipulate and break the human mind, pushing prisoners to their limits in ways that were calculated, systematic, and utterly inhumane. One of the primary objectives of these psychological experiments was to study the effects of extreme stress, trauma, and deprivation on human behavior. Prisoners were subjected to prolonged periods of isolation, starvation, sleep deprivation, and forced labor. The intent was to understand how humans would react under extreme pressure and to gather information that could supposedly be applied to military and social control contexts. For instance, prisoners were locked in small, dark cells for days or weeks at a time, sometimes chained or restrained to prevent movement. This isolation led to severe mental distress, hallucinations, and, in many cases, complete psychological breakdown. Sleep deprivation experiments were conducted to observe how exhaustion affected decision-making, perception, and emotional stability. Prisoners were forced to remain awake for days without rest, often while performing physically demanding tasks or being subjected to interrogations and mock executions. Researchers meticulously documented the prisoners' behavior, noting signs of confusion, aggression, and mental collapse. Victims frequently experienced paranoia, anxiety attacks, and long-lasting mental disorders. Some prisoners died from exhaustion or complications caused by extreme fatigue, highlighting the deadly consequences of these experiments. Starvation and malnutrition experiments were another cruel method used to study psychological and behavioral changes. Inmates were fed severely restricted diets, sometimes only a few hundred calories per day, while their physical and mental responses were monitored. Researchers examined changes in mood, cognitive function, social interactions, and survival behavior. These studies, particularly conducted at Ravensbrück and Auschwitz, revealed how deprivation could alter human behavior, eroding empathy, provoking aggression, and causing profound despair. Prisoners became malnourished, weak, and vulnerable to disease, yet their suffering was systematically exploited for data collection. In addition to deprivation, Nazi researchers also explored obedience, conformity, and human compliance under extreme authority. Prisoners were placed in situations designed to elicit fear, submission, or moral conflict. They were forced to obey orders that caused pain to themselves or others, observed for signs of resistance or compliance. These experiments were in line with the broader ideological goal of demonstrating how authority could manipulate and control human populations, a principle the Nazis believed was essential for their totalitarian regime. Behavioral experiments extended to testing the limits of pain tolerance and human endurance. Inmates were subjected to electric shocks, cold exposure, and simulated combat scenarios to measure reactions and survival instincts. For example, some prisoners were confined in freezing chambers, deprived of protective clothing, and observed for how long they could withstand the cold. Others were exposed to repetitive loud noises, sensory deprivation, or visual stressors designed to destabilize their psychological equilibrium. The goal was to understand how humans might be pushed to extreme physical and mental limits, yet the methods ignored every standard of humane treatment. Children were tragically included in these experiments. Josef Mengelé's twin studies often incorporated psychological testing, including stress induction, observation of emotional reactions, and monitoring responses to fear and pain. Other experiments sought to understand learning, memory, and cognitive development under extreme conditions. Infants and young children were deliberately traumatized, and the results were recorded with clinical detachment. Survivors recounted nightmares, phobias, and deep emotional scars that lasted a lifetime. Some experiments explored moral decision-making and social behavior under duress. Prisoners were placed in situations where they had to make impossible choices, to save themselves at the expense of others, or to watch loved ones suffer. Researchers documented guilt, compliance, rebellion, and the breakdown of social bonds under extreme stress. These studies were less about science and more about demonstrating the Nazis' ideology of domination, control, and the manipulation of human morality. The ethical violations in psychological experimentation were complete and systematic. Unlike modern studies, where consent, protection, and debriefing are essential, Nazi researchers deliberately sought to create harm and fear. Observation, documentation, and analysis were secondary to the goal of exploiting human suffering. The prisoners were treated not as individuals, but as instruments to measure the effects of cruelty, trauma, and control. Prisoners often suffered long-term psychological consequences. Many survivors endured post-traumatic stress disorder, depression, anxiety, and chronic nightmares for decades after liberation. Families and communities were left to cope with the aftermath of these experiments, as entire generations carried the emotional scars of these atrocities. Psychological research in Nazi camps became an enduring lesson in the catastrophic consequences of unethical human experimentation. These experiments also highlight the chilling efficiency with which science can be manipulated for ideological purposes. Pseudoscientific concepts such as racial superiority, eugenics, and social Darwinism provided justification for manipulating minds and behaviors. Researchers ignored fundamental principles of human dignity, morality, and consent, replacing them with a brutal system where suffering was treated as data and death as an acceptable outcome. In conclusion, The psychological and behavioral experiments of Nazi Germany were an extension of the regime's totalitarian ideology. From sleep deprivation and starvation to forced moral dilemmas and sensory torture, prisoners were subjected to conditions designed to break the mind. The experiments revealed nothing about the limits of humanity that could not have been studied ethically, and they left survivors with trauma that often lasted a lifetime. By examining these atrocities, we recognize the necessity of ethical oversight, empathy, and respect for human dignity in both science and society. The horrors of psychological experimentation during World War II remain a stark warning of what can occur when ideology, authority, and cruelty intersect with scientific curiosity. The atrocities committed by Nazi doctors and researchers during World War II left an indelible mark on history. While the immediate horrors, sterilizations, chemical exposures, high-altitude and freezing experiments, infectious diseases, surgical tortures, and psychological manipulations were confined to the victims and the camps, their repercussions extended far beyond the end of the war. The world would be forced to confront not only the sheer cruelty of these acts, but also the urgent need to establish moral and legal frameworks to prevent anything like this from happening again. The Nuremberg trials, held between 1945 and 1946, represented the first attempt to systematically address crimes against humanity and crimes committed under the guise of medical science. Among the trials, the doctors' trial, officially United States of America versus Karl Brandt et al., prosecuted 23 Nazi doctors and administrators for their involvement in human experimentation and mass murder. The charges included conducting experiments without consent, torture, and the murder of prisoners, as well as participation in the euthanasia programs targeting the mentally and physically disabled. During these trials, shocking evidence was presented. Victim testimonies, photographs, laboratory notes, and camp records illustrated the systematic nature of these crimes. The prosecution highlighted the widespread collaboration between state authorities, medical professionals, and private organizations, showing that cruelty was institutionalized and deliberate. Defendants attempted to justify their actions as necessary for science, military advancement, or ideological reasons. Some claimed they were following orders, while others insisted that the experiments had scientific merit. Yet the overwhelming evidence of intentional harm and disregard for human life made clear the criminal nature of their actions. The trial verdicts were consequential and far-reaching. 7 of the defendants were sentenced to death, including prominent figures such as Karl Brandt, Hitler's personal physician and one of the architects of the T4 euthanasia program. Others received lengthy prison sentences, while some were acquitted due to lack of evidence or successful legal defense. Importantly, the trials established a legal precedent. Medical professionals could be held criminally accountable for unethical human experimentation, even if their actions were sanctioned by a government. This principle became a cornerstone for modern medical ethics and international law. One of the most enduring legacies of these trials was the formulation of the Nuremberg Code in 1947. The code established 10 fundamental principles for conducting research on human subjects, emphasizing voluntary consent, the necessity of avoiding unnecessary suffering, and the importance of scientifically valid procedures. The code states, in part, that the voluntary consent of the human subject is absolutely essential, and that experiments should yield results for the good of society, unattainable by other means, without causing death or disabling injury, except where absolutely necessary. These guidelines directly responded to the abuses committed by Nazi doctors, creating a benchmark for ethical research worldwide. Beyond legal reforms, the legacy of Nazi human experimentation deeply influenced medical ethics, education, and research oversight. Universities and medical institutions were compelled to reevaluate their training, ensuring that future generations of doctors understood the moral responsibilities of their profession. Institutional review boards, IRBs, were established globally to oversee human research, ensuring that experiments comply with ethical standards and that participants provide informed consent. The horrors of Auschwitz, Dachau, and other camps demonstrated that scientific achievement cannot justify inhumane treatment, and that moral responsibility must always take precedence. The psychological impact on survivors, families, and society at large was profound. Many survivors lived with permanent physical disabilities, chronic illness, and deep emotional trauma. Entire communities were scarred by the knowledge that family members had been subjected to unimaginable suffering. Memorials, museums, and educational programs were established to honor victims and to ensure that future generations remember the atrocities. Auschwitz-Birkenau, Dachau, and Ravensbrück remain symbols of human cruelty, but also serve as places of learning and reflection, reminding the world of the consequences of hatred and unethical science. The influence of Nazi human experimentation also extended to international human rights legislation. The Universal Declaration of Human Rights, adopted by the United Nations in 1948, enshrined the rights to life, liberty, and security, reflecting lessons learned from the abuse of power during World War II. Additionally, international treaties, such as the Geneva Conventions and the Declaration of Helsinki, reinforced protections for human subjects in medical research, emphasizing ethical treatment and the protection of vulnerable populations. Yet despite these legal and ethical reforms, the legacy of these experiments continues to provoke difficult questions. Some post-war scientific research controversially utilized data obtained from Nazi experiments, sparking debates about the morality of benefiting from knowledge acquired through suffering. Bioethicists, historians, and scientists continue to grapple with the tension between potential scientific value and the immorality of the methods used to obtain it. These discussions underscore the importance of remembering history, not only as a record of past atrocities, but as a guide for moral decision-making in contemporary science and medicine. Moreover, the story of Nazi experiments serves as a cautionary tale about the danger of ideology overriding ethics. The doctors who participated were often highly trained professionals, yet they allowed racist, nationalist, and militaristic ideology to supersede their moral obligations. This raises critical questions about human behavior under authoritarian regimes and the conditions under which ordinary individuals can commit extraordinary crimes. Understanding these factors is crucial for preventing future abuses, whether in medicine, research, or governance. The legacy of Nazi human experimentation is also evident in contemporary bioethics education. Medical students and researchers study these cases to understand the importance of consent, the vulnerability of certain populations, and the moral responsibilities of scientists. Ethical frameworks developed in the post-war period, such as the Belmont Report and modern IRB protocols, are direct descendants of the lessons learned from Auschwitz, Dachau, and other camps. These safeguards exist to prevent a recurrence of such atrocities, ensuring that science serves humanity rather than harms it. In reflecting on the scale and nature of these crimes, it is impossible to ignore the human cost. Tens of thousands of individuals suffered and died due to experiments that provided little genuine scientific benefit. Families were destroyed, communities traumatized, and generations affected by the physical and psychological consequences. The magnitude of suffering is a stark reminder of the dangers of unchecked power, ideology-driven science, and moral compromise. Finally, remembering the legacy of Nazi experiments is not merely about documenting horror, it is about learning and vigilance. By confronting this history, we acknowledge the victims, honor their suffering, and reinforce the ethical principles that protect human dignity. Modern science, medicine, and law are deeply indebted to these lessons, which remind us that human life and morality must never be sacrificed for ideology, ambition, or profit. In conclusion, the legacy and trials stemming from Nazi human experimentation represent a final reckoning with one of humanity's darkest chapters. The Nuremberg trials, the formulation of the Nuremberg Code, and the subsequent development of global ethical and legal standards ensured that the atrocities would not be forgotten, and that future generations of scientists, doctors, and citizens would be reminded of the consequences of moral failure. This chapter is not only a historical account, but a warning. Science without ethics, ideology without conscience, and authority without accountability can lead to unspeakable cruelty. By studying, remembering, and educating ourselves about these events, we honor the victims and commit to a future where human dignity is never again subordinated to the machinery of oppression.